Hi, everyone, and welcome to our webinar this morning on helping women return to the workforce. I'm Veronica Goodman, the Director of Social Policy at the Progressive Policy Institute. Our event today is also co-hosted with the Mosaic project at PPI, an initiative to identify, elevate, connect, and advocate for a network of diverse women experts in economics and technology. I want to first thank Senator Gillibrand and our incredible panelists for making the time for this important discussion. I'm sure many in this audience are aware, but the job losses from the COVID recession have disproportionately impacted women, and especially Black and Hispanic workers. Women's labor force participation has not been this low since the 1980s, and the pandemic stands to erase decades of progress. According to the US Census Bureau, as of last month, almost 1.5 million fewer moms of school-aged children were actively working than in February 2020, and overall women have been slower to return to the workforce than men. A new Washington Post ABC poll out this morning reported that a quarter of women say they are financially worse off a year into the pandemic. But I think we can all agree that even before the pandemic, women, and especially working moms, have lacked the support they need to thrive in our economy. So I see this event as an opportunity to not just discuss policies to help women return to the workforce, but to return to the workforce better supported. So thank you all for joining us. With that, I would like to introduce our keynote speaker, Senator Gillibrand of New York. She's been a tireless advocate and champion in Congress for women and working families, and she sponsored and advocated for countless pieces of legislation on issues such as paid family leave and affordable childcare that would improve the lives of millions of working parents and families. So we really appreciate you making the time to join us today, Senator, and we're very excited to hear your remarks.
Well, good morning, everybody. I want to start by thanking Veronica and everyone at the Progressive Policy Institute for putting this event together. And I want to thank all the panelists for their outstanding advocacy and leadership in this space. The work that you've done has really made a difference, and I think we will move this country forward. On the net, women have lost a net of 5.4 million jobs during this pandemic. The jobs from December tell the whole story. That month, the economy suffered a net loss of 140,000 jobs, but men gained 16,000 jobs. That means every net job lost belonged to a woman, and almost all of them belonged to a woman of color. We know that their families and our economy cannot recover without getting women back to work. First, we have to address the fact that if kids can't go to school, women can't return to the workforce. Our schools are not just the foundations for the success for our children, but they're also critical to the success of women, families, and communities. When schools can't operate normally, nothing can. That's why I fought so hard in the American Rescue Plan to include $130 billion to help our schools implement the CDC guidelines, make the much needed improvements to their facilities and HVAC systems, and make it safe for teachers and students to return to the classroom. And as we continue working to recover and rebuild the economy, we need to build a better system that the one that left too many women with no choice but to leave their jobs and schools when schools were closed for in-person learning. Our economic infrastructure has been failing women and families for years, and it has crumbled in the face of this pandemic. When we talk about building new infrastructure, we need to talk about what it really takes to allow everyone to reach their full economic potential so that our economy can also reach its full economic potential. So that's why I've been pushing the American Families Plan. I called on President Biden to include universal paid leave and medical leave in his plan, and all signs point to his proposal making a significant investment in paid leave. I first introduced the Family Act, which would create permanent universal paid leave in 2013. And now, not even a decade later, we stand on the precipice of implementing a policy that will transform our economy and ensure that American workers, especially our women, are no longer forced to choose between their families and their paychecks. Having paid leave will mean that when families face emergencies, women won't have to leave their jobs and step off their career ladder knowing that they may never get back on again or have to start over from the bottom rung. I will fight alongside President Biden to pass this critical legislation in the Senate. We also need to invest in the care economy so that women have someone they can trust to care for their children or their aging parents during the workday. Right now, families may have to wait as long as 5 years to get the home care services they need for loved ones who are aging or disabled. That's 5 years out of the workforce for someone who needs to stay home and provide that care. I was so glad to see President Biden prioritize funding for caregiving in the American Jobs Plan. When we improve caregiving jobs with legislation like the Domestic Workers Bill of Rights, the benefits are twofold. First, we help improve the lives of people, mostly women of color, who hold those jobs. And second, we make those jobs more desirable and bring more people into the caregiving workforce, helping more families get back to work faster. It's also critical that we increase access to quality, affordable daycare. The childcare industry has been decimated over the last year as providers faced rising costs and declining enrollment. And accessing childcare was an issue even before the pandemic. It was not available. In 2018, more than half of the country lived in a childcare desert, and it was not affordable. Childcare for infant care can cost $15,000 a year. A mom who works full-time for a minimum wage will earn $15,080 a year. So obviously there's no way she can afford for daycare. There's just no way that many people in America could afford the care that they need. So we pushed for the American Rescue Plan to address this crisis, and it includes $40 billion to help hard-hit childcare providers who are disproportionately women of color, cover the rising costs, and provide families with additional tax credit for as much as half of their spending on childcare for young children. And that, we believe is the single biggest investment in childcare since World War II. And we shouldn't stop there. We need universal pre-K. If we expect children to succeed in schools and careers of tomorrow, we have to give them a strong foundation that starts with pre-K. Congress recognized that 50 years ago with bipartisan legislation to establish universal pre-K, but President Nixon vetoed it. That's 5 decades where we could have been creating a better equity in our educational opportunity, preparing our children for a better future, and making it easier for more women to get back to work. So we really can't wait any longer. Finally, we need to ensure that when women do get back to work, that they're earning a fair and equal wage. This starts with raising the minimum wage to $15 an hour. 4 in 5 minimum wage earners are adults. Nearly 2 in 3 are women, and most are trying to support their families. They can't do that on $7.25 an hour. And they can't do it if they aren't earning a dollar on a dollar for the work that they do. We need to close the pay gap that pushes women, and especially women of color, further behind every day. Right now, millions of American families feel like when it comes to work, everything is working against them, and they're not wrong. Congress and state capitals have failed to keep up with the realities of our modern economy. For working parents and women especially, this new economic infrastructure is just as critical to getting work as the roads and trains that they have to take to get to the office. It will allow people to really provide for their families and give them the resources, the care, and the opportunities that they need to succeed. These changes we have needed for a long time. These issues existed long before the pandemic and will continue to exist long after if we don't act now. This is the moment to think big and enact bold transformational policies. This is the moment to take the long view, to look at the bigger picture, and to make sure that families can not only recover from this crisis, but weather the crisis of the future. If we don't, we are only shortchanging ourselves. So thank you all for being here and being part of this work. It will take all of us, and you can count on me to keep fighting alongside you until we rebuild an economy where everyone can reach their fullest potential. Thank you.
Thank you so much for those wonderful remarks, Senator Gillibrand, and for fighting for moms and for working families. We really appreciate it, and that you could be a part of this discussion today. Before you hop off, I wanted to give our panelists an opportunity to ask any questions that they may have. Does anyone on the panel have a question for Senator Gillibrand?
I'm happy to ask one if no one else will. Senator Gillibrand, there are several, I've been delighted to see several different proposals coming out through the Democratic caucus and the administration around childcare. The American Families Act, as you mentioned, is going to include, it looks like a significant outlay. The Childcare for Working Families Act was just reintroduced last week. The Universal Child Care and Early Learning Act is likely to be reintroduced today. And I'm just curious, your thoughts on, the best path forward for the United States child care system.
So I think it's really important that these ideas are included in the next COVID relief bill. And if the Democrats decide that they want to do this through reconciliation, you could do a lot of it, because reconciliation is a legislative tool that's used for budgets, to set a budget for up to 10 years. And we can do paid leave as part of that reconciliation package. We could also do a lot of this childcare spending and early childhood education spending. So I'm hopeful that a whole package can be put in the next COVID relief bill, because this is the soft infrastructure of our economy. If you don't have paid leave, affordable daycare, universal pre-K now, when are you ever going to build it? It is what will get our workers back to the workplace. And we desperately need it for America's women and America's caregivers. We also have to start taking and treating the caregiver economy seriously. And that means making sure people earn at least a minimum wage, if not a higher wage, and certainly one that's indexed to inflation. So there's some structural changes that I want to work on, particularly with regard to Social Security, Medicare, and Medicaid, about compensating care through those programs and allowing seniors and people with disabilities to age in place and to be at home, which means compensating their caregivers, whether it's a parent or a family member, through programs like Medicaid, so that you don't have to institutionalize your loved ones. Those are structural changes that we have to make that hopefully we can make in the next 6 months as we do different appropriations bills.
Thank you.
So I'd like to jump in and piggyback on, I guess not a question, but a thank you. As one who is not married, does not have children, I'm happy to hear the conversation more broadly about care. I often feel in these conversations when we're talking about women, we're not talking about me. We're often talking about mothers, and I'm not a mother, right? And so it is often annoying to me that when we talk about women, it often becomes synonymous with two sets of folks. It is either white women or it is mothers. And so I'm grateful that to hear you talk about care more broadly for those of us who have aging parents. I'm in my parents' home. So, my mother is asking me, what do I want for dinner on the other side?
I love it. I would like to tell her what I want for dinner.
Yes.
Yes.
And so I completely, appreciate to hear this conversation expanded. So thank you for that.
It's so important, because the truth is that COVID has disproportionately harmed women of color, period. And they are the ones that are left behind in all of these conversations. So if you're not talking about all care, meaning aging parents, sick family members, illnesses that you have yourself, life events, chosen family members, these are all different conversations that are often left off. And many people who are against our ambition and our vision do so purposefully. They want to focus only on parenting. They want to focus only on female parenting. They try to narrow it as small as they can make it. But the truth is, we need a care economy, and the care workers themselves have to be front and center, because most care workers are women of color. So the low wages that are received from care centers, from assisted living facilities, for disabled Americans is just so low that we have to make sure everyone's paid a living wage, so that this infrastructure around care allows everyone to thrive. And it has to be a much broader conversation. And I'm so grateful that certainly all of you know that, but that we can lift this up because the president understands it. And so we want to make sure that when the president's formulating these bills, that he fully understands that we have his back on this, and that we will support and lift up his vision to make sure it gets passed. And the other thing that I think gets left out often is that everyone is for this at this point. Like, even white male Republicans want paid leave. So we have the majority of the country behind us. And I think this epidemic has shown where where our infrastructure has crumbled, where we have not and even more broadly, just the definition of critical work. So often we don't see care as critical work. Now we know it's critical work. Now we know that certainly everyone who works in the healthcare industry, anyone who is responsible for caring for loved ones, without them, the country falls apart. So again, defining critical work more broadly, more accurately, and hopefully having conversations about rewarding that work with higher pay, better benefits, and more support overall. So thank you, Rhonda. Well said.
Well, I hope that you will hang around, because your comment about care work being women of color being primarily employed in that is one of the things that I'd like to push back against, because care work is a very broad category. And one of the things that Fatima Gross-Graves pointed out on another panel that I was on with her about women and work is that we don't often talk about schools as childcare, right? But that has been so much of the challenge because schools are closed. And when you look in that space, if you think about them as caregivers, that's an industry that's majority white.
Right.
So
Yeah.
women, right? So when we talk about this care industry, and this is the question that Veronica asked me about, like, why is it important to disaggregate data? That's a category that's not homogeneous. It's got several occupations in it, and they're not all primarily occupied by Asian, Black, Hispanic, and Native American women, right?
Yep.
And so we want to be mindful of that when we're even talking about the care industry, that it's very diverse.
And I think for education, if you talk to educators, they don't necessarily see themselves in the care economy. But what I would like to have them see themselves, and us to see them in at some point, is they are critical workforce. And so we had an absolute wrong-headed approach to COVID. We should have, from the beginning, identified education as critical workforce, but we didn't. And the entire care economy should be designated as critical workforce, and our entire educational system should have been designated as critical workforce, because then we could have flowed resources so they could open safely. Why were schools left out of getting PPE, of resources to spread kids out, getting testing on site? So I saw the real divide. Wealthy private schools were able to have on-site testing. They were able to have every kid got a piece of PPE every day, so they could have a disposable mask. I saw how schools did this, and they did it because they had resources. And President Trump was wrong to not say the economy can't work if people can't be at work. And all of this is critical workforce. And all of those professionals that work in our schools and support staff should have been first in line for vaccines, along with our seniors, our most vulnerable. They should have been able to get resources for the PPE and the testing, because we just don't look at properly. And so just like nurses and doctors and EMTs are critical workforce, I think our teachers should have also been so designated and given the support they need to have been able to open safely, because the places that did give resources opened safely. And that's it. And so it's our worldview. We don't identify critical work appropriately. We don't actually pay people appropriately, and we don't reward the work as important as it is. And you see that in the entire care economy and in the teaching economy. And it's very frustrating to me. And it's largely female. So again, the critical workforce is largely female, and we don't reward any of that work. It's all marginalized.
Great. Well, thank you again, Senator Gillibrand. And we're excited to see how the conversation evolves this week around the American Family Plan and everything on Congress.
Well, thank you guys again for being such thoughtful champions and extraordinary leaders in this space. And I will do everything I can to lift your voices up and your perspectives up so that we can have a really robust conversation nationally and get this done. So thank you.
Thank you. Great. Well, now we are going to turn to our panel, and we have a really talented group of experts working on various policy areas that impact women and working families. I'll introduce each of them now, ask some questions on their respective areas of expertise, and then we'll wrap up with a Q&A with the audience. And if those in the audience have any questions, please feel free to drop them at any time in the chat, and we'll try to get to some of them at the end. And just a quick note for our panelists that even though I may ask a direct question of you, please feel free to jump in at any time. I would love to make this as much of a conversation as possible. Chandra Childers is a study director for economic security, mobility, and equity at the Institute for Women's Policy Research. Her research focuses on employment, earnings, job quality, and the future of work. And her recent publications include Building a Better Future for Women in New Orleans Post-COVID-19, Here to Stay, Black, Latina, and Afro-Latina Women in the Construction Trades, and Women, Automation, and the Future of Work. So welcome, Chandra. Rhonda V. Sharpe is an economist and mathematician who specializes in large data sets to find the stories hidden in the aggregate. Her research shows that by disaggregating data, we can identify the nuances and outcomes that can improve economic well-being. Rhonda is the president and founder of the Women's Institute for Science, Equity, and Race. And I would be remiss if I did not mention that she is also part of our Mosaic project this year. So welcome back, Rhonda. And last but not least, Elliot Haspel is an early childhood policy expert and author of the book Crawling Behind, America's Child Care Crisis and How to Fix It. Quick aside that I read it and it's excellent. So just a plug that if you haven't, please go pick up a copy. Elliot's work has been featured in the New York Times, the Atlantic, and the Washington Post, among other mediums, and he resides in Richmond, Virginia with his wife and 2 young daughters. So thank you all for being here. My first question is for Rhonda. Thinking about data and trends, as you mentioned, in your work and writing, you advocate for how data needs to be disaggregated to not treat women as a monolith. The pandemic has disproportionately impacted women, but in particular, it has hurt Black and Hispanic women. Can you please speak to how policymakers should be thinking about different groups of women as we consider an appropriate policy response? And I know you previewed this a little bit with the senator, so thank you.
So what I want to do is start by saying that disaggregating data is not a new concept, right? If you look at the health industry, they have been doing this for a long time. It is one of the ways that we know that Black women have a lower incidence of breast cancer, but a higher mortality rate. It is how we know that Black men are more likely to get prostate cancer and are twice as likely to die from it. So I want to start there by saying, I'm not advocating for anything that isn't already being done, but what we are advocating for is that the disaggregation of data moves beyond the way we see data reported, and that is we will often see it reported by racial categories. And when that is done, it is biased because you're centering, usually the analysis centers on whiteness, or we will see data disaggregated men, women. And when we do that, it is biased because it then centers men. So what we'd like to have policymakers and researchers do is to disaggregate data so that it takes into consideration the complexities of individuals and how that influences outcome. So plainly put, what do you think influences labor market participation? And some of what we talked about here is whether or not you have care for your family and your children. We know that occupation segregation is going to influence that. We're seeing that location just in terms of restriction and the way aid is being provided influences. And that's how we'd like to see people disaggregate data, not in what I'd like to think of as the banal and trite way that we've seen it, but at the intersections of the complexities, because it is then that we will see the nuances in the outcomes, and that will allow us to craft better policies. So, one of the things that sticks out in my mind as I've been advocating for the disaggregation of data, if we can think back to a year ago, and sometimes it's so hard to believe, like, it's been a year, right? It was a year ago that we, almost when the May numbers come out for May next Friday, right? When the numbers come out for the economic job situation, it will be a year since we saw 12 million women become unemployed, right? And the term coming out, a she-cession. And what struck me about that was so much of the conversation still came back to Black and Hispanic women. And I want to ask folks to rethink the way that we use disproportionately. So I'm saying to folks in my circle that when we talk about how something disproportionately impacts a group, what many hear is that this does not impact me. And so it is easy to dismiss it. And I'd also argue that disproportionality is code word for the structural and racial inequality that has impacted marginalized groups, however you want to categorize those. But in that 12 million, no one noticed, or if they did, they didn't talk about it, that 8 million of those women were white, right? So 3 out of the 4 of the women who were unemployed at the start of this she session were white women. The conversation was still focused on the unemployment rate of Black and Hispanic women. And again, no one noticed paid attention to the increase in the change from 1 month to the next. So for me, when we're talking about disaggregating data, it is so that we can get at those nuances. Now, I would be remiss, and somebody out there is probably going to put in the question, like, sometimes the data does not allow us to disaggregate data. And Chandra and Elliot, I'm sorry, I don't know much about you, but if you are one who works with data, we know this very well, right? Like, sample size does not allow you to disaggregate data in the ways that we are advocating for. And to do that, it means that we need better funding for the US Census and the Bureau of Labor Statistics so that they can go through and oversample oversample. And for me, I'm thinking about, I like to see them oversampling Asians. I'd like to see the economic situation summary that comes out disaggregate Asians so that we can see them over 20. We can see what's happening with Asian women. We know that there's an increase in hate crime, but we really don't have an understanding of how this is playing out for Asian women, which we know, for starters, not a homogeneous group, right? Right. The diversity within the Asian population often is going to influence their labor market experience, the occupation segregation that we often don't talk about within the Asian racial group, like by looking at the ethnicities. So I'd like to see that as an oversampling and that disaggregation so we can see how this is impacting them. But more than that, I think that when we're talking about disaggregating data and we're talking about an equitable recovery, you can't do that if you don't see the nuances, if we don't see the barriers and the structure, the barriers that are preventing full participation in the labor market. You can't craft effective policies. And then what I always like to say is that when we disaggregate data, we'll allow folks to see themselves in the data. We arm them with the information to advocate for full participation. And I think it just really moves us towards a more equitable society, and it allows us to hold folks accountable, and it also allows us to measure progress, right? Where we're not talking about the progress of women, and then you have, my fellow colleague Janelle Jones, when she's talking about best women, Black women best, or tomorrow the National Economics Association is going to be hosting a talk by Michelle Holder talking about the double blind for Black women, right? Like you don't come back and see that because we've been talking about women without thinking about how it's not a monolithic experience for women, not just during this pandemic, but every day, our experiences are not the same. So when we're advocating for disaggregating data, we're just asking people to think about the bias in the aggregate, and then think about what characteristics influence the outcomes, and disaggregate the data on that. So thank you for that question.
Yeah, my pleasure. And did you want to turn to any of your slides, or we're just...
No, I'm good. I am. No, I don't. But I do. I think the other thing that I would add to that is, and I'm probably going to get in trouble for this, but when I've looked at Biden's jobs plan, the thing that struck me is how gendered it is, right? Infrastructure And when you look at who does infrastructure work, it is primarily men. And I would say to the audience, if you haven't done so, I'd encourage you to go look at IWPR's report in collaboration with Chicago Trade Union, and maybe Chandra talk a little bit more about it, where they're talking about women in the trade. And I've done some consulting with the American Petroleum Institute. A lot of these jobs on the infrastructure side are male dominated, right? Granted, when the infrastructure is in place, when we have high-speed broadband more broadly and in rural spaces, and we have more childcare, it will be beneficial for women who are primarily in the care industry. But in the interim, the folks that we're going to see going back to work are going to be men. And then we're going to be back at this conversation talking about this unequalness in recovery, because we haven't really thought about who gets infrastructure jobs, right? Who's employed in that? And that's men, right? Got to disaggregate that to pay attention to who's in those spaces. So now I'm done, right? Because that's the thing that's been bugging me. I'm not hearing anyone. And it's really bothering me that no, I don't hear the conversation about how gendered that is. Benefits for women, but that's a long ways down the road.
Well, you read my mind, Rhonda, because actually the question that I had posed to Chandra was exactly about the American Jobs Plan. And so I'll let you be able to reply to that now, Chandra. And my question that I sort of originally asked her was that the American Jobs Plan has dedicated funding for workforce development, including apprenticeships. But women have sort of historically been excluded from these jobs. So I would love for her to sort of talk us through that and how we can help women better access these opportunities in employment.
Well, and as Rhonda has already kind of laid out, a lot of the work that I've been doing recently, IWPR has been doing for a while, but I've recently moved into is looking at moving women into these male-dominated jobs. We know that, the gender wage gap, a big part of that, fully half of that is occupational and industry segregation, because women and men work in completely different jobs. And you're right, when you look at these infrastructure jobs, those jobs are well and away male-dominated occupations. However, there are a lot of women who do work in construction. The problem is because when we talk about the construction trades, and I'm going to throw transportation in there, I'm going to throw manufacturing in there. But when we look at those, it's such a large occupation that, and I think this is the report you're thinking about is with the Chicago Women in the Trades, interviews that we did with tradeswomen who work in the construction trades. And, there were a lot of issues and concerns. One, let me start off with the positive. They love their work. They love the work that they do. They love working in the trades. They're good paying jobs. Most of them, they do not require, long-term training. So these are, we talk to women who actually had like bachelor's degrees and were in professional occupations, but they found the trades. And this was a job that they don't have to go build up a lot of student loan debt. They can, and we have a similar one, the New Orleans paper is going and looking at opportunities in New Orleans, because that economy in COVID, you're talking about the hospitality industry is a big part, but finding ways to move these women, especially the Black women within New Orleans, who tend to get overlooked for jobs like this. So, but there are opportunities to move women into those occupations. A lot of the problems that women face moving into these types of jobs is because they are isolated, because, one of the things that kept coming up over and over is they're the only woman on the work site. That makes life a whole lot different than if you've got more women, even if they're not even in your trade, just seeing another woman on your work site. And it has implications for access to bathrooms, to whether or not the equipment will be made to fit you, whether it's safe. So there's a lot of factors there. So when I'm looking through the plan that's laid out for infrastructure, I completely agree that these tend to be male-dominated jobs, and there's only so many women we're going to be able to move into those occupations. So, I mean, I'm under no illusions. We're not going to, we're going to have 50-50 men and women in the construction trades. However, I do think we can definitely do better than we're doing. And so another big issue that I think I saw, I know I saw in talking to women in construction is that they had no idea about construction. They didn't know this was an option. They didn't know how to get into construction. And that was part of the work in New Orleans, is if you don't have a pre-apprenticeship program, if you don't have people out informing, it's a lot of women across the nation who are needing other jobs to move into, whose jobs are gone, or their jobs may come back, but they're really terrible jobs. And until we can do something about raising pay and getting some benefits to those workers, and maybe they do need to look for some other things. But also, getting young people in school before they go run up all that student loan debt. I graduated with so much student loan debt. It was just, it's absolutely ridiculous. So in looking at that plan, there were a lot of pieces of the plan that I actually did like. However, one thing is, you're absolutely right. It's missing pieces, because apprenticeship doesn't have to just be construction. There's lots of things that we can do apprenticeships around. I do think that's an important piece. I would like to make sure that whatever finally gets implemented, that there are accountability measures in place that ensure that women, that, Black people, Hispanic, that everyone actually, that the contractors, that wherever that money goes, that people are held accountable to ensure opportunities are open to everyone. That was one thing I did not see. But also, yes, opening that up to a wider range of occupations to provide the training piece of that, I think, is an important piece, and making sure that that gets broadened so that it's not just focused on jobs that will go to men, because women have disproportionately been harmed in this recession. But women also are represented in a lot of these jobs that, again, pay levels, access to benefits, and they're not getting any better. So I think I'm responding there to a discussion that we're having, as well as to your question. So I hope I got your question in there.
No, you did. Thank you so much, Chandra. And I'll ask Elliot now. So he's written a bit about wages and just the general care economy. And so I'd love to give him an opportunity to sort of respond to that. And I wanted to also just tee up for him to just generally share his thoughts on the childcare crisis and how it's contributed to difficulties for families and parents during the pandemic.
Yeah, absolutely. Thanks. And this has been a great conversation so far. I think a piece of the puzzle when it comes to the wages, and so childcare industry, employs well over 2 million women, almost entirely women, like 97% women. Of those, the childcare workforce is about 40% women of color. And there's also a very high proportion of women who are immigrants, or who also represents other kinds of, you kind of split it aside in other ways, but it's a very diverse workforce, sort of no matter how you look at it, except for along the gender, and they are by and large getting paid miserably low wages. So the median wage for a child care worker in this country is $11.65. The median wage, which means half the people are making less than that. And those who are making more is not making a whole lot more. And there are very few opportunities for advancement. And this goes to the structural flaws in the childcare system. So, which is part of why there is such a childcare crisis in America that existed, as the senator was talking about before we ever heard of COVID. And unless we do something about it, it's going to exist as we exit the pandemic. So fundamentally, childcare is one of those things I like to say it has managed to not work for anyone involved. So childcare is expensive to deliver. It's expensive because you need the necessary ratio of adults to children is extremely low, as it should be, because you don't want, one adult trying to care for 25 kids. Like I was a fourth grade teacher back in the day, and I had, at one point, like 30 fourth graders in my class, and that's too many fourth graders, but like I could do it, like, with the ages and everything, but the ratios in most states, you one childcare teacher for 4 or 6, sort of toddlers, maybe you can get to 8 or 10, 3 or 4-year-olds. Those ratios are so much lower. It drives the personnel costs sky high. But because we have such a low public investment, the U.S. manages to put in the 3rd lowest percentage of our GDP of any developed nation, when it comes to our early care and education system. And so because it's such low public investment, these providers have no place to turn but to parents, but you can only wring so much out of parents, even middle class and upper middle class parents. So you are, charging these folks $10,000, $15,000 a year. And you're taking a loss per kid, because the true cost of care, if you actually want to be able to pay a good wage, is more up in like the $25,000, $30,000 per kid level. So if you think about that, I'm far from the first one to say this, but people have been pointing out for a while now, most of what's happening is that the workforce, the women, again, who are largely women of color, are actually subsidizing the care economy for the rest of us by taking lower wages. That's where it's coming from. It's coming out of their wallet, it's coming out of their bank accounts. That's the system that we have. And so, the question is going to be now, like, which way forward? I think we've got pretty broad agreement it's not working, but there are, as I was mentioning, several different kind of proposals on the table about what to do about it. And the American Rescue Plan was amazing in stabilizing the industry so that we kind of stanch the bleeding. But we need to now think about, with the American Families Plan, where are we going to go from here? And so one of the questions that I sort of have and I've sort of push on is, right now the childcare system is very much built on a welfare frame. So all of our childcare assistance goes through basically either you get a Head Start or you go through childcare subsidy. And to get subsidy, you have to prove your eligibility, by your income limits. You have to prove that you're working or job training, or you're currently getting continuing education. And it was very intentionally designed to be hard to get onto and not to stay on it for very long. And so, you can go look back at the history of this if you're curious, but unsurprisingly, it has very racist and classist, sort of undertones. It's built into the system that's intended to be welfare. And so we have this question ahead of us of, do we continue to try to make a welfare system work better and someone just expand it out so that it's more, the eligibility goes up into the middle class and you kind of continue to build in this subsidy way? Or do we actually transition to an entirely new way of thinking about childcare in this country, more as a public good, more as a right? So the contrast between childcare and the K-12 system obviously is extremely stark. When you have a 3-year-old, you're running around trying desperately to find any slots that you can find that you might be able to afford. Quality unfortunately becomes something of an afterthought. So you're just so happy to find someplace that you can take your kid and they can afford it. And then your kid turns 5 or 6, and like magically the state is like, here, and like, here, please come, like we'll do, for at least for the working hours. I mean, it doesn't match up with the work day, but at least for like 7 hours a day, like we'll take care of your child for the next 13 years for free, like aside from your taxes. And it's a very different way of thinking about it. It's a right. It's a right in all 50 state constitutions to public education. There's a right in 0 state constitutions to childcare. And so I think that's the question is, when we think about, potentially $225 billion coming in, that's significant, but it's not enough to transform the system if it's not used strategically, if it's not leveraged, if it's not done in a way also that honors the very wide variety of needs and preferences that parents, and particularly, again, women, have. And that includes, we know that many women need care during non-traditional hours. If you're a nurse working on the night shift at a hospital and you're a single parent, like you actually need childcare overnight. And that needs to be something that there are many parents who prefer to have their child in a family childcare setting where they're going to someone's home and it's smaller, it's not a childcare center. Language is a significant, issue where you prefer to have your child with somebody who speaks your language or who shares your religious values. And all of that's fine, by the way, from a child development perspective, so long as the caregiver is warm and stable and attentive, like the kid's going to do just fine. But to develop that pluralistic system, that pluralistic rights-based system, That's the question that we have on the table is, you know, more money is needed prerequisite to doing anything else, because the other thing, and then I'll sort of be quiet, is with the workforce as low paid as it is, a natural consequence of that is the turnover is incredibly high. There's a study recently out of Louisiana, which the authors think is pretty generalizable, that up to 50% of childcare teachers who work in these private centers are basically walking out the door every year, and they're not going to a different center, they're just leaving. Which again, look, if you might love working with kids, but if the difference is making $11 an hour working with, you know, a childcare center and making $15 an hour working at Target down the street with some health benefits, like that's not a difficult decision. And so, you know, childcare is, unfortunately, for having been a low wage industry for a long time, is now becoming a less competitive low wage industry, which is really, really dangerous. It's dangerous for children, it's dangerous for parents, and it's only going to keep getting worse until we get this really sustained, very high level investment of public money to finally make good on what we should have been doing for a very long time, which is, you know, creating a childcare system where parents have the choice and the right to create a system that's going to work for them and for their families.
Thank you, Elliot. That's great. And as someone with a 4 and 1 year old, this is all a little too real for me when thinking about it. So I think one theme coming out of everybody's comments is that there are pieces of the American Families Plan or some of the COVID legislation that's already come out. But Chandra, you pointed out that you wish there was more accountability for some of the ways that the workforce development money is going to go in terms of outcomes. And Elliot, you're talking too a little bit about, you know, the way the money will be funneled through. So I guess as we think about all this money that's potentially on the table being invested into our institutions and systems, are there any other sort of out of the box ways that you hope the money could be used, or the way we're thinking about a particular area like early education or workforce development?
So I kind of want to look, the person who doesn't have the child wants to chime in and say, you know, as Elliot was talking about childcare and education, you know, to me, the model is DC, right? In which, you know, 3 to 4 year olds, it's public, pre-K, and the Center for American Progress has done some studies on what it means. And so as I was listening to Elliot, it just made me think, does there need to be a shift in the way that we frame this? That it's not about childcare, but it is about early education, right? It is about providing early education and giving all of our students access early to education. And if we shift that way, then it's not childcare, right? It's an investment, it's an education investment that perhaps we can, as the infrastructure is coming through to build better schools and childcare facilities, perhaps they can expand some existing schools. So there is the capacity to bring these 3 and 4 year olds in and to begin learning. Now, having said that, we also know that there's research out there that suggests that there's even bias in that often when you are talking about, in particular, Black and Brown students, it is less about education. It is more about behavior. It is more about, do you understand how to raise your hand? It's all the things that we know when you are a gifted child, you get, I should say gifted and white, you get a buy with, right? You get to speak up. You don't have to raise your hand. But when you are not white and you display these behaviors, I need to curb that. Then you are a discipline problem. And so I'm just wondering if that's a potential reframing that gets us around this, at least for the 3 to 4 year olds.
Yeah, I think that certainly has some merit to it. I think part of it too is this idea of combining care and education. Like for a long time in this country, and there's sort of in the sense that care is one thing and education is another. And you were talking about, you know, it's been kind of come up through this conversation that like schools actually, if 0 to 5 is early care and education, I actually submit that elementary school is middle childhood care and education, and high school is adolescent care and education. But we sliced off the care part. And honestly, there's a history to it too, right? Like this was, if you go back to the teaching profession and sort of the first half of the 20th century, again, a profession that is largely made up of white women that was trying to differentiate, so trying to professionalize, right, and get itself to a higher level of stature and pay and everything. And so we did, I think, see some interesting bucking from the K-12 teachers about like, we're not babysitters, to which I'm like, I don't know what childcare teachers aren't babysitters either. So like, this is a skillful, so I think, the idea of DC and this idea of the school frame, I think is really useful. Because you're right, like people get that, like it's interesting, like people can like be like, it doesn't make a lot of sense if you actually press on it, but like instinctively, if you're like, okay, like pre-K for 4-year-olds is going to be free. We're just taking the public school system and marching it backwards a year. But childcare should be free. And they're like, no, it shouldn't be free. Why are you giving this away to parents? And I'm like, you can do it for the 4-year-old. The 4-year-old, it's the same kid. Like it's not, the settings aren't fundamentally different. What's going on inside of a pre-K setting is going inside of a childcare center, which has 4-year-olds. They're not like some like astronomically different enterprise. But I do think, to your point, like if we can take that idea of, look, this is working well, because you're right, the CAP study found that within about 4 years of implementation, the maternal employment rate of mothers of younger 3 and 4-year-olds equalized with mothers of school-aged kids. It does not take long. This has been the experience everywhere internationally that has ever done some version of this. Is like the maternal employment rate goes up like that, and actually pays for itself through that more than through the child outcomes. So I think that's the question. How do we say, all right, parents need support starting at birth. They need paid family leave. They need support for their toddlers, and they need support for their 3 and their 4-year-olds. So we're going to create this seamless arc of, basically early care and education. And I will say it worries me actually a little bit that we sometimes do separate out. We're like, here's the bucket of pre-K money. It's just going to go through the schools. Here's the bucket of childcare money, which is going to go through the subsidy. And then we get this weird bifurcated thing where like, the pre-K teachers are getting paid way more than the teachers of the 2-year-olds. And like, that's not really, and so, I think you're spot on with this idea of like pre-K is popular, it's understandable, it gets a lot of investment. How do we learn from that messaging lesson and then apply it to a whole suite of birth to 5?
And then remove the means testing. Elliot and I are in the same city. And one of the things that Mayor Stoney ran on, Elliot, and I don't know if you remember this,
Yep.
but that was part of it. He said he was looking to expand, early childhood education for these 3 and 4-year-olds. And he was reflecting on his experience. And I know someone put a question in the chat with a single father, right? And what so many of these programs meant to him. So I just say that to say that I also like the way that you attach it to the welfare system, right? Because for so many kids to go to the public school system for pre-care, it's means tested, right? You got to be from a poor family to have access.
Well, and Elliot, I completely agree with that as well. I actually, when I was doing my early grad school, I worked with Early Head Start. And part of that, it is about child development. It is about, from the very beginning, molding and developing minds and skills and abilities. And as you were talking about separating out that care from education, and I'm thinking like, and I don't know which came first, the chicken or the, which of these is it that because, as you said, people are so desperate to find care that they can't spend the time, or they don't have the money for quality care. And so the education does get pulled out, because you do wind up with, low wage, I hate that term, but workers who are paid very little, rather than getting people that are highly skilled with the developmental training, but you would have to pay those workers more. And so then we get caught up in that cycle, rather than actually looking at these as professionals who are it's about whole child development, not just education, but the development of the entire child. It is an investment. And if you pay more, you can then get better quality, but that does mean you have to find the money. And as you said, parents don't have that money. So kind of where to break into that cycle there.
Right, with sort of the literally, it's a failed market, most economists agree, and like the model doesn't work. So unless you're injecting public money, you can't. And all of our other efforts to improve the childcare system are basically just throwing a lot of money into the wind, because again, half of them are leaving each year. So what we know is that like the foundation of quality, and set aside this sort of ongoing debate about degrees and credentials in early childhood. fundamentally, children require stable, reliable relationships with like warm caregivers who like will have a back and forth with them. And if you are super stressed out about the fact that like you can't figure out what your own kid's going to do with childcare, or much less like put food on the table, like that's not an awesome headspace to be in, to be dealing with like, you know, a 2-year-old who's throwing a temper tantrum. And you know, and so yeah, I mean, fundamentally, we have to get the salaries. And again, I agree with you. It's not just like, I don't even just want these to be minimum wage jobs. I want these to be family sustaining wages with benefits. Like these should be, you know, really, because the other thing is, and you know, we actually think about the number of hours a day. It's actually, in some ways, it's arguably a more difficult job to be a childcare practitioner. You know, you're working 9-hour shifts. Your children may not be potty trained. Like, you know, this is very, very physical. It's much more physical than I was a 4th grade teacher. So, you know, it's a very skillful job, and not everyone can do it. So we do need to, you know, honor and reward that work.
And I want to piggyback on the two things that you both have said, and that is that it is skilled work, right? And I think it is unfortunate that it is another one of the skilled jobs that women have that is in the care industry and not respected, right? Because it's care, even though, like, I think even as a teacher, right? When you think about what teachers have to do, there's a huge part of that is teaching, but there's also a part of that is care. And I mean that from the standpoint that you really need to be connected with your students to know what's going on. Teachers now have a responsibility to report welfare situations, right? When a child is being abused at home, that to me adds another layer of care in addition to the teaching aspect. I don't think people often think about childcare workers in particular as being skilled, right? They don't recognize it, that even if it is a 2-year community degree, they have made the investment in education. And if we're asking people to tool up, to skill up, to make those investments in education, they have to go into occupations that then, if they've been incurred debt, can begin to actually, you know, to think about how do you go about repaying that, right? And I don't think that that's what we do. But again, to me, that is just part of the isms in our society about women's work.
Yeah, and I'm so glad that you dropped this article into the chat, Elliot, that's been sort of making its rounds this week, that talks about there's no such thing as a low skill worker. Because I could not agree more that we need to rethink how we think about these workers and all of the skills that they really need, from mental health facilitators to child development, that really are key to investing. We have a question in the chat that I wanted to read for everyone that wants to jump in. It says, how do we shift culture so that the expectations for care aren't only hoisted on women? Is increasing paternity leave something that could help?
I'm happy to take it, but if one of you wants to go first, I've been talking a bit.
Go for it, Elliot.
Okay, so yeah, I think two things. One, it does require both culture and policy at the same time. So one thing that they found in Europe, right, is like you offered like this broad like family leave benefit, and then like the women were taking all of it, and the men were taking none of it. And it wasn't until, I think it's Spain or Denmark, one of them finally did like, it has to be, it's like 14 weeks. Like either the men have to take it or it's gone. You can't just transfer it over to your partner. And then another piece of that is also normalizing like the idea of men actually taking the leave that's available to them. This was again something like Japan found, is like they offer generous leave benefits, and they wanted to help with their fertility rate, and this was around the turn of the 2010s, and then like none of the men were taking it, so it wasn't changing anything. And so they went a very intentional campaign, like basically a PR campaign, to like normalize the idea of like men, and there are some similar efforts underway in the US. Like Dove has their like Real Man campaign. I forget the exact name of it, but like there are various sort of like companies and literal marketing efforts to like get out there and like, you know, and to get celebrities sort of to model it and to, because it does need to be, there has certainly been a shift in the past, you know, since the millennium towards an increase in you know, male sort of primary caregivers, but it's still like, you know, it's under 10%. So I do think that we need to work on sort of multi-pronged approach to that. And then part of it too, I think, is also getting men, we talked about, so Chandra, about getting women into more of the male-dominated industries. I think there's also room to talk about how do we get more men into the female-dominated industries. So there's a program, for example, here in Richmond and a few other cities that a nonprofit runs, which and it's called Leading Men, and it's specifically recruiting young men of color to be assistant teachers in pre-K programs. And part of the idea is like to intentionally try to get more men into the early childhood space, particularly men of color, because we do know that children who see teachers and caregivers that reflect their own sort of identity characteristics, that tends to be a boon for them. And so for the boys of color, who only ever see women in the first sort of like 5 years of their lives as the caregiver, like that's sort of some of the theory of change. So I do think they could help, but it's not going to be just a policy thing. What we know from other other nations, I think our own sort of experiences, is going to require some intentional work on the culture side too.
So I always also chime on that, and to say that in this pandemic, I haven't seen very many panels that are talking to fathers about being at home. And what you see anecdotally, and I can remember having a conversation with a father who was at home, I think with an 8-year-old and a 5-year-old, and talking about exercise is scheduled and what they do for exercise. And he kind of scared me. Like, I was like, oh my gosh, when his daughter goes back to school, I'm feeling for that teacher, because this is what he said. He says, being at home with her, I understand how she learns. Right. And I was like, wow, poor teacher in the fall, because here was the father coming in saying, no, that's not how she learns. So I think that in the conversations about COVID and women, we are biased because we're not having these conversations with fathers about their experience being at home, and then how many of them would like to continue that. Because I think if we're having the conversation to be able to support them to have, a more flexible work schedule so that they can interact with their students, I think many of them may feel more comfortable going out and advocating for that, as opposed to hearing it's women. So the expectation is I need to fall back into my role, and I put this in quotation mark, as a provider, as a father, as not the person who is a caregiver. So I think it's not just about them, but it's also the ways in which we are framing the conversation about who's going back to work and who's providing care.
Absolutely. So I think we're just about time, but I did want to just say thank you all for this insightful discussion and for participating on the panel. I wanted to give you all an opportunity for a closing thought if you have one now. Great. All right. Otherwise, well, wonderful. Thank you to everyone for joining us today for our webinar on helping women return to the workforce. Special round of applause to our keynote speaker, Senator Gillibrand, and to our wonderful panelists here. I'm excited to carry these ideas and momentum of the discussion forward. And for more of our work and to learn more about the Mosaic project, please visit progressivepolicy.org, and have a great rest of your day.